Yɛda Nyankopɔn ase sɛ nnɛ nso aka yɛ ho Enrich Your Family series. Dwumadi a yɛdedi nkɔmmɔ fa abusua ne awareɛ mu nsɛm mu na ɛnnɛ nso yɛaba so yi. Nnɛ nea ɔne yɛbɛkasa no yɛ Dr. Boampong Akese. Na yɛbɛdi ho nkɔmmɔ no yɛ very, very important subject. Ɛyɛ mental illness among children. Yeah, ne yɛkaa sɛ mental illness wɔ mpanimfoɔ nko mu. But ɛha nkɔdaa so paa. Dr. Edwase paa sɛ nnɛ nyame nam wo so na wɔbɛkyerɛkyerɛ yɛn. Boa me ate saa nsɛm yi ase. Bɔ mpaeɛ sɛ yɛadesua yi no ɛbɛboa ɛne a yɛaba so nnɛ na yɛne afoforɔ nso ɛbɛkyɛ. Nti mebɔ mpaeɛ wie a na yɛbɔ adwom no ɛne yɛbɛtie no ɛyɛ Dr. Boampong Akese. Yɛbɛbɔ dwom no ansa na yɛabɔ mpaeɛ no. Ɛm sɛ medane no. Nti mekɔfa adwom no aba na yɛbɔ wie ya ne a ɛdi hɔ no ɛyɛ Dr. Boampong. Yo, Doctor, ɛberɛ a woba soɔ no ɛbɔ akyiri na mede ama ɛnnɛ deɛ wode wɔ ma yɛn so no wode ama yɛn. Onyame nka yɛn nyinaa ho berɛ a yɛsua mental health among children. Nyame nka ho.
Nneɛma bi ho no. Ɔmo understanding wɔ nneɛma bi ho no. Ayɛ ana ɛka akyi. Obu akora kyerɛ sɛ even to the points of benyini aduru bɛyɛ 30 anaasɛ even nimfie so kora no. The expert will tell you that the brain of a 5-year-old. That is intellectual disability. And so these problems are distressing to children and disrupt their ability to function well at home, in school, or in other social situations. The mental illness affects emotions, mood, perception, and behavior, and can be suffered by people of all levels of intellectual disability. And in pain, women say people with intellectual disability are more likely to have mental illness at the same time. But I knew be our mental illness, no intellectual disability. So mental illness can onset at any age. It can be a temporal condition and be experienced in cycle or episode, or may reoccur through life. Into the mental illness, it can occur at any age. And just temporal condition with the right treatment, you can treat or cure mental illness, and you can experience it within your life cycle. But intellectual disability in a permanent condition, we don't cure it. There's no way we can cure it, but just that with the right programs, we can help the person to learn some basic life skills. So it is quite possible for a person with intellectual disability also to suffer from mental illness, in which case that secondary condition will be treated with appropriate medication and support. Now, about mental illness, suicide is the second leading cause of death at the younger generation between 10 and 19, and is the 10th leading cause of death among all Americans. But the woman said, all these younger folks are more committed suicide. Most of them have serious mental illness condition because which means a mental illness is a serious problem. Now, research shows up to 90% of people who have died by suicide suffered from, some form of mental illness. So children who experience a stressful life event may feel intense sadness or loss, anxiety, anger, and hopelessness, and may occasionally have the thought that they would be better off dead. Omoni da so nyina asane pempi no ana omote wa de feel ze omu kura mfaso e wo so chen se omo betena asase so Na we bisa na mental illness kura den na e cause den na deba. Especially within nkwara. Den nkwara na cause na most mental illness are caused by a combination of factors which cannot be completely prevented. You know, factors na deba na bi won ma yentumi nsia no, but bi won so we can prevent it. So the exact cause of most mental illness is not known. But if you say a combination of these factors, which includes heredity, biological, psychological trauma, and environmental stress. Okay, some of the causes are there to me mental illness. The kinds of family violence, abuse, or neglect. If you say in Pala most of the time, or more in fear, abia, our for the be an akikiri asumdie any fear. And a bium Kalane, they are being abused, they be a brom, just and Titiano and Shada and yet Papano. They are likely to develop some form of mental illness. And broken home, and I say, be a Kalomuni with fear, be a for and tem ate. And the Santoso a ye we hear a biana more acid music assembly and kuye ewo fear. They are likely to kind of develop mental illness. Now, some of the warning signs of mental illness in Nkwala. Today be a oye our for ono baneti. Unumubano chain ubia. At least when you start to identify some of these symptoms, ABI or obano ne the we are only obanidin kitahun with no the suban be start to say as a sign. You have to be able to identify the slightest changes ewo obano suban. Then you begin to ask what is going on. Now try say if there's any problem obeso anontem. If there's a one so anontem and on that it did you mucha from being after the acquire as some cassia. Copa some cassiaba. Into persistent sadness, 2 or more weeks. Withdrawing, from or avoiding social interaction. Maybe a bano, maybe a man's opinipa not a canon nehoba. At one point, maybe was started withdraw the biaze or quota baby no drain and most of the time and the raho. Hurting oneself or talking about hurting oneself. Nkolani bi one ma out one on alpha blade editwa no ho me hu bi da oto ha me fa sekan ono atwa no de etwitwa no ho saa just say the moment no best start so or yes no no normal human being will begin to hurt so ono atwa no or the blade etwitwa no ho the moment now akolan best start yes you just have to realize there's something wrong with Obano. And talking about death or suicide, maybe starting so or kasa so if you are fan cry then you realize that maybe and maybe outburst or extreme irritability, out of control behavior that can be harmful. Or to an is soon be a who here, maybe be a who here, the suban be a wafa just say the bufu are not to near just or says and near my be an but right away was started to develop this kind of subana. You just have to start to question. Drastic change in mood, behavior or personality. Sometimes the fluctuation in mood no crew maybe America say bipolar, independent bipolar, be our stress is here and I feel in both changes in eating habit, at once or starting a mental form of mental illness. Na need any eduanidie. If you want ma odidi, obu nso ojai eduanidie. Intino is either way around. Obu nso na so started to lose weight. Difficulty in sleeping. obu so afedi na na sema basa. And sometimes they complain about headaches and stomach aches. Sometimes headache can be other form of other medical condition and stomach aches. But again, so it's also another symptoms for mental illness. Difficult concentrating. Maybe oku school it's not the crowd to me focus. To one say na this year which is the changes in academic performance na this year one say be an modern bo conform oku school they avoid school oku school adebia Roma they see detention debia na don't know na to detention is that oku school always a lot of problems going on in school. We are just a few now. Let's say some of the common mental illness in children, and I'm pretty sure say we are now anxiety, affective disorder, and as a mood. Sometimes we can say maybe bipolar, your schizophrenia, and so on. So we are just a few, but iguma hodro edoso. Now, some of the barriers to treating childhood mental health disorder, and as a mental illness in children. Na a problem in pain when in kwala started some develop that kind of mental illness na ayana into me the professionals so one barriers to mental health can mental health care for young children is the impression that young children do not develop mental health problems and are immune to the effects of early adversity and trauma because they are inherently resilient and grow out of behavior problems and emotional difficulties. In pain pino, na Ghana for the Pingas and Akola radio no neha understand then or doing one ubenya adwimu how. That kind of adwin na ye woni ntino. Say Akola no start to say bia or dance to be a decora or foot because me ba we the on the son not you is hunu ye ne me ba we the oni abotre ba ko ba kokora to say ni bufu a we the sene papa I na sometimes and now said that is the kind of mentality na ye wo intino ebia na akola na start to develop some form of mental illness but we consider say akola de ono den e hanwa ono no onye adwuma ne nan kan nsanka papa na ekọ ene maame na etoma ne di intina de intina ese bibi ha no. Children mental health problems are real, common and treatable. Although 1 in 5 children have a diagnosable mental health problem, nearly 2/3 of them get little or no help. This is and now because that is adwin ye wofa nkwala adwin mu ha hu nsɛm in pain pino say problem no start here yen tankope emwa ana in time per se yebeso ano which most of this we will blame the parents for that. It can be difficult to understand mental health disorders in children because normal childhood development is a process that involves changes and involve change. Sometimes it's very difficult because the one ma akolo 3 years and 4 years na nusu krakra na nusu sheshe and someone nko a entino say akola bi sa no so okoti bi bi musa na how as a parent kana we bi how can you tell say ebia the akola no eko some anaso will develop some form of mental illness into that is also one of the barriers are sometimes being able to identify and to diagnose akola or that kind of mental illness. So the symptoms of a disorder may differ depending on child's age, and children may not be able to explain how they feel or why they are behaving a certain way. In pain, this kind of mental illness it differs from age to age, and again, sometimes we'll be they will not be able to on to mean ye enkyerɛ sɛ bi a sei na ɛyɛ na anaasɛ sei na ebi a sei na or go through. But sometimes maybe you just want to understand say bi a then or go through. Sometimes we be sankola na ɛden sɛ ɔno ankasa betumi akyerɛkyerɛ mu ne atenka wonya na sɛ yeah, that kind of feeling na wonya no it becomes like a barrier to treating mental illness in Kuala. And concerns about the stigma associated with mental illness. So near me share my presentation me kind. I am not that kind of very any new na the attached into. So buokranas and the bar was at equasati be them cry. Or farese or beba out abeka na wabepe emwa. The use of medication and the cost of logistical challenge of treatment might also prevent parents from seeking care for a child who has suspected mental illness. Ibu onso ana ebia na esikasem ntina ebia na emma awofo ma out. But again, among Ghana for one day, I know say most of sad day has something to do with the superstition and a new that stigma now we attach to mental illness. Now, supporting children mental health. I'm quite bad so need to me abua mofra mental illness. Mental disorders can also interfere with child's health development, causing problems that can continue into adulthood. Parents play an important role in supporting their children. You know your child best. If you have concerns about the way your child behaves at home, in school, or with friends, talk to your child's healthcare professional. Say akola be go through any form of mental illness. Na say yang so anon tem na so dinyinia obenyi na afedi akoye fa asem kese ne ediaba. Ntina wofo bia no wo asudie kese wo asudie say utumi and because no ban atifi ntina se because oba no mu a you should be able to detect. And I say utumi kosu kra ko bisa the counselors and I say the teacher for about ebi oba no any year bi e wo school. And as I say sometimes the school will call parents to kind of tell them say the ekoso ewo omoba no la ebi a ze na oba no be school and so ban sesa se bibisa esia any kwansa otnase say bia utuba no for fine with me tuba no for there, but sometimes it would be wise if we can seek additional help from any healthcare professional. The parents and family members are usually the first to notice if a child has problems with emotions or behavior. So your observations along with those of teachers and other caregivers can help determine whether you need to seek help for your child. In the same we should be able to notice any form of emotions and as a behavior. As a I say after 12 for frame boy amanye efa ebia ye mano suban ana say omoti bi bomkumu a ese say yetumi etu anamon. Now seek ways to relax and have fun with your child. In the way ye kwanya ibitumi afaso support your man and praise your child's strength and abilities. Most of our for nekamya say dear your man ya the papa bia ye de bia na ye commonim ni etwumonim ni ye commonim ni etwumonim a be mark a big creating impression be be kwana na bia na umpenasem. And the moment they start to worry too much, say bia umpenasem no it me mano enya ehu bi kra to mission mu a bit me cause stress, a bit me cause anxiety, a bit me cause depression ewo nkwala ne mu ti ehu hia awofo ene omoma in term like the relationship no it should be good as I say to me ene oba enya that kind of inkitahudie and work with your child's school to secure necessary support. Maybe to the school system no etuanamo abom sɛ bɛyɛ a sɛ ɛmoa bi a wobɛtumi ade apɛ ama aba sɛ in case ɔba ɛkɔ saa tibia no mu a wobɛtumi apɛ ɛde ama aba ne sɛ wotumi tu saa anamo no ɛna yɛn try sɛ bɛbɔ yɛn ma so ɔmaba so sɛ ɔmoyɛ adeɛ no ɛyɛ a yɛmbɔ ɔmaba so ɛno no na build ɔmo confidence ɛna it kind of reduces that kind of stress most of the nkwalaa no and so we have to also educate ourselves. We have to know more about illness at least if you know the symptoms you can identify say A, B, and easily. You can identify easily say anytime there's any kind of changes going on it will be to me identify those symptoms right away and consider family counseling that treats all members as partners in the treatment plan, and ask your child's mental health professionals for advice on how to how to respond to your child and handle difficult behaviors. Say oba ako TBAB say muna say any of the health professionals somehow what you need to do as I say also to me enya entity be from the health professional kwanya also no to me afaso a handle ba to me afaso aboa most of the corona or more institutions na there they have treatment plans the caregivers kind of follow to make sure that whatever treatment planner the clinicians and the psychologists are more put together no they make sure say they follow. But the ones who happen someone on my phone you have to make sure say the treatment plan is being followed. As a parent, you can also enroll in any training program just to learn more about mental illness in in kwara. I no kra no if you say obako sa TBN mu a parent nankasa no kra no because you begin to worry, begin to think, and as you worry, as you think about Tibiana or Banukum, more or less you're getting depressed, you're getting stressed out, and depression is also another form of mental illness. Say to me, it make sure say their mental health is good at yenso our phones and yenso to me a sound mind to focus on our daily life activities. Now, some of the treatment options for mental illness. This is psychotherapy. This is individual psychotherapy or family education psychotherapy. Therapy. That is one of the treatment options. It drew most of the time they drew a streamer, and sometimes they use medication. I am not a big fan of medication, but then there are situations that to me go past medication. There are drew a with the right therapy, I think that it will kind of resolve the problem. But if you want more there, to me and skip medication, you have to take the medication. Your special education programs or your treatment programs or inpatient residential programs or your a lot of day treatment programs or most of them are buying and a sponsor. You're sure say you move be a more any agencies BTS 7 Hills Ventures and just name them. One of my admins said these are some of the programs that they these are some of the programs are for people in that kind of situation. See in Devra or Rutland, that is another institution for children in that kind of situation. And Abana and there are programs around Airboa, so that be Yankwala or Moko sa Tibianimuno. The right treatment. Now in situations I be akola no enya abayama ne no de realize sometimes the justice system need to which is the legal response in the we said detention. Some of them help end up in group homes and probation at the end. So there are other programs around that BOA to help treat any form of mental illness in Kwara. I think say me de madisua no ebesi ya me pese ebekọ ye nim bebre to me de besi ha na this is just a general overview of mental illness in children, but yeah, well, different area any ebia any treatment any ebia any symptoms tre ya fa no mako ya ka ya rebia ho asam. We are just a general overview, me de masem nyina besi ya na afedie ebie line so bi wo questions and I say a foot to be the map our phone so na yenina aya adusua de ama yenina ewo yehiem wa ha.
Okay. Doctor, that's a pa one ngansi yen gra ma hu se Desmond a man in saso nti me mama kwan na afi betimi adi nkomo bi se na me kan ani mo ho no we a very important subject. Men kan we ntwa mu ya yo no emisa me hunu de ntie bi atore bi ada yenia Patrick be host to bi onya challenges na bia na me oba bi na me de me phone no e connect ka ho a na disrupt no me ye na me hunu se de me phone ye nti no wo start ya me ye se me call online no ama me kwan na ye se me set another online portal nti me catch half meanwhile na me timi record we hunu sa na nti anim ho kakra bi na manya nti bia wo online no you still get pretty much everything. Desmond, I'm so comment or question nti me ma kwan na wa koso then I was all the boy.
So for that's doctor that's if and I'm ebusa a tuntum any abrofo no say share statistics and for pa na sa mentally affect you. And the next question.
Okay.
Mental illness it doesn't discriminate. It affects everybody. But the woman is there, unzemrofono, or mafan serious. In the Santa Bia Bajense Biamrofono, and what argument how chain before. But yen or how, but unzamidigan can ye be before na sometimes you consider so before the ye tough, ye be free by an idea. Nya dear, sa I don't know. But I must be honest, so do Ghana. That's why I think coffee be near me say fana yari. Right? But and nam say en tambo who de and I say Yafana says sa Yafana says sa it had become normal to us. But then I'm not going to say Imrofono our problem changed before. Nipa. So yeah, the same thing, just Imrofono, they consider that very serious and something important. Always they make sure say they're getting treatment.
Yeah, that's the entire me busa say they also train. For instance, if you are Ghana free, if you are not a ba ewo situation bi musa na makosiki gardeners and I say bon say o maka say o ukrom ni Ghana bi e connections for no kuno. But and now say me krom ni Ghana ni eba be hu say me bai ewo say situation no o we na adresse na wonko. So o we na adresse wonko na wo de ahye ne ho saa na afi de develop akura ne saa na obenyine no yes why vagabond and I say wa first situation fufuru mu but ebia anka ye advice say kone ko hu krom Ghana ne the entire no can say language barrier ne ntino o ka me see a otiase onu me hu ekwan a the same treatment don we treat ukobo no ha the same thing obeka ukọ Ghana ni wa the same thing obeka but onu ka ukrom kasa ne ntino what so culture na say na wonya adaje church ba ye no ya ba ha no ebia if you say, you'll be one cocaine and not crank, and I say, me put near me, actually, and also hard, that's
Yo, opinion that's me. That's them say, what can I just this week? That was Monday. One of the case managers, can say, on the gun and you, maybe in a dinkumo, neba, a problem, but my meaning in this and a no problem. Into a can I am a straight. So that is young call for because me how cram mechano. Ana how yenya akwenya aba crew we more. There are a lot of resources are banned for people in that situation. But yes, still some digging kind of sometimes the parent becomes like a problem. If you say the woman say oh no ban ya na wamba outa. They can't identify Obano.
No.
And now to me by force and chose chinchinia brabaje emwa. You have to come out and seek that help and as a support. But the nam say, yen say, I don't know, there's nothing you can do about it. Yeah, Obano, our problem. Also nyini. Nyamebeye. Or the nanam. Sorry, Yakobom Payamano. Say Niariano a bit to ako. I don't know if you have for idea, maybe you can help me understand. Is it always any night sumuyariana? Because sometimes I don't know how yang before not yet but mampa we count even crewing before no in the history of mental health treatment at one point no one should believe was a witchcraft. The moment now ubenya that kind of adwimuha no move believe we say a witchcraft into the previous people they ended up in institutions. They were being more treated. But as they begin to understand more about that condition. They have changed and as they've evolved from that kind of mentality. But before we're still stuck with that kind of adrenaline. So that is another problem. And that's another challenge. Before and I think say
doctor, me say what kapa. Unfortunately, no. We push blame quickly to Abeifo. Me be our semi-call Ghana, na me be man in Suno. Na me obi bam honan saying, sir. Was a pastor me bano. Was a son dae basa na menino. O yenima basa we are not a food more than them. We are no butu dano, we are not the idea of 2 dear, or they are boss ceiling, and so me ceiling say a pine print. Minima the crop. Busana was young hano, Nanano menina casa a teenager or bear 13. Or say I am a didn't call Ghana no. That could be na my sister Ketua, a man of candy, or man of candy no. And na if you hold na I has ye or no crow him say near my hair hano. Nam say into would ya same way. Almost as any okay can. Mental health among children. Maybe I mean Fabian can't Desmond. The problem until Desmond, if I bring Petsy about room for her, I don't know only Dr. Mwakam. Mental health in general no have stigmatization and labeling. Who say young, especially in the minorities now. Additional breach, I say, if you say, a mental health person, about them. Hey, now what's on the best what about them? There be Saudo backwa saw them, no, Hurifan Kunyaso, no, to Boncroft, no, to think way back is going to fire. We saw any no soon croffer, or how. As I saw what has here, now Pequan be so a busachly. A busachly is a pet, final call, hospital. And no, the doctor need home commos and a bay, or yeah, one say, I saw more hyper. Yes, near maybe a promoter, sir. Like so, Bano would a situation near my brain, Sani Manema. But happening in an be and there's something more behind that. Oh, so doctor, coming back to the name can say to one among and find share a bay for unkuna. And I said, dog, taking nyame fa druya for so ye jumao. And Tibra Bompire was saw them. Go and seek medical help. Nyame nam sa for no so ebeboa since be akodano. Let me give you an example. Obi an eba war issues na otifie. Na wonim de ode ma no. Wo se wa fresh of obi e wo Europe. E ma asem na ba me ho no. Say wo frɛ me say eyi sofo bi bompaye egu olive oil so na asa. Enti nka memmo bi nguso ono koto foforo memmo mpaye nguso na omfa mane ba na me say for what? Na kese ye di nkomo no wo ka asem we na me say enti wo do ba na tifie na wo sa olive oil e ma no nom da bia esan sofo bi abompaye egu so fa no hospital. So these are some of the things that be a because he believes say a spiritual issue. Spiritual issue. No, while we are praying, God, nyame so na mani panim die, mon besua, so betimi abo. Nyame fa druye for so e ya mama die. Apani Patrick, Mr. Ross do me pa.
Yo, Pastor, pedawase. Doctor, nyame nhyira wo. Asɛm nyinaa na waka ne tiawa no. Na de ba ko a o si etimi ho ne say. Sometimes we look for symptoms and as patterns. Are very important. And yes, that could be a said the person I mean use example no. Akula no edi bibi boss sele no munkwan. Hey, anwa boda. Now to me sure. Utimi say no man ne ye no ekoso de bia. Utimi say at least every for the past 2 weeks and I say you know. Utimi say sa na akoso ade achi dia. Na also what you say adi enye se bia psychoanalysis supposed to say to become a
Yes.
We look for patterns. Say the doctor be dance here. Mental health is real. Now doctor now say Africa for any Liberia for the magic and other African countries they are seeking help. Now the help is there. And then to know basana symptoms no a bit is delusional or paranoid ideation.
Yes.
It's real. Now so no say ya seeking help your bebre. Doctor me no ya adwene. And you now say medication, psychotherapy is bit my day abua. And yes, let me say we are a for we a ja we and now say symptoms no persistent symptoms in air cosua. Mr. Seek help. The earlier you do it, the better. I mean, sure, Pastor Manuel.
Yeah, that's a power penny for you. You say, Doctor,
yeah. Let me say, Penny Patrick, Yamishra, I say, just what come ask him in Amami. Idea, real, to be honest with Yenina. But I will repeat and say this over and over again. Yen ebi before no. I don't even know how to put a sad way. If you say I've had the chance to interact with other ebiphobia, just say a yesunsumu yare. Remember one example. There was one incident here. A young lady be Krumhaya, Worcestershire. We go through high school. And Chomako College. Right away, and we develop some form of mental illness, schizophrenia, and another one. Some of them in PNTM. If you want to meet PA at the age of 18, 17, if you want more, but was a bit severe, no, maybe a wedding be 15, 16. If you're not more as a normal kid, maybe at once, will be already free. And this parent happened to be an African. And you can imagine, Bibi an Adrian Benenam.
Yeah.
If you say a plano, no our dreams of a medical doctor. And now all of a sudden, Yari Abefrim, Tenenia, a yenifie for no person a banu be in Tina or more a aclan. Just all country amamenente. And ye opposite or the aclano a Nikrum, a comma, sofubius, a herbalist beer, obey to me, Asanyari. It's not always I'm going to repeat this again. It's not always. And it's real. It be a yarea. There are ways and as there are treatment options. Once you are open and as you come out to get to him one, the professionals will be willing to help you out. Into a lot of education, Emma Yena. So when you be or what's that, and the baby was that be anymore, what can I say them one? Encourage that person, say, man, I'm fan a banning shed them. If you say, one son on them, as you could do stage be a bay too serious, a back of fat in some case, be cry, so change the current situation of cry, Abram.
Yeah. That's by most Antidora, Pachokos why. Antidora, our home, most of my own sasso.
Pastor, young Pacho, that's a song, doctor, Namisha. Pacho, Pastor Motiminka.
Yeah, Tonka.
Okay, that's it. My question, Pastor, a doctor can. Na me baby busa say, nye a young Koran kwana warm son, and the boy yana me sure say young penny for cran, mothers who sometimes boo how to move say, and the man could ye. And a doctor Pacho, but me question and say, and Koran qua, na you wanna send penny for so you can.
Yeah, I'm saying mental illness doesn't discriminate. You be and Zania openly Patrick a kind and yet. Bibia obehuno and nabagasi be a mental. Wouldn't say sometimes Ibua Wangasatu or Ubiantons or to Anankasa Kasakasa. Then no Bagase Ebiahu Jumuhawana. Sometimes situation between my ASR. I'm not impending for no, especially most of the time, sometimes Ebia Naye or Remunsemunkuya. Sometimes we could need na Atonia Kasakasa. Na Ebua say usika se munku ye kura it me emma go through situation be but we always look for symptoms and the symptoms not just one symptom yes like list of some symptoms here and there should be some kind of consistent like a pattern in a period.
Yeah,
then the professionals can diagnose, say, okay, based on ABR symptoms AZYR unyano maybe for like 2-3 months then ABR probably a year BBC. Now the woman say most of yano na sinam dinga can say you can't say you how and yet do about them on nam kwanchen kwa ubu on ma or paranoid ubu on ma or to be ankan on you be endi ehunu bi ahyenema yeah, well, it is a PTSD, post traumatic stress disorder. To say be a quenchie be on yan on quite a brima na same be a two be a chum the say who Anna your case yes you or waka no sono who PTSD because the moment now we born pe in cramiasem one so to say internal. Yeah, one way or the other. And I would say that maybe we have some form of mental illness. And in penny for enyebi anna in kwalanso enyebi. You was some nanwa.
Yeah. Antidora, I said Dr. Akano. Once I net the 18 year canon in the past presentation, the only focus on penny for and penny for will be pa. Sanya Dr. Hase ano kano. Ye krom no. So mental health illness ayane ye kano yes wabodam. So but enye no kwa mbenimfo wo enkoda wo na. Esan se ndem na pese doctor pese odigina enkoda so. Ebi amen through being hwe worker say I'm looking at a researcher. It was done in just 2017, yeah, which is 5 years ago. Even though in research, it sometimes it'd be a little late, old, but there are a lot of symptoms be a betimi de ehunu se oba e wo sad in be emotional disorders so ne behavioral na behavioral and answer be hyperactivity. I'm looking at the research maybe hyperactivity disorder and one say what no bati ho na say consistently no nya dakropo da bia no say woni attention ebre bia say anopa no wasoro say yemompa no yedi bochi na na dwena kosi bibi so tete ya na dwena kosi bibi so woni tika ma bon so oka we so hyper I saw them about say time nchen woni be ba no afuri wonam ha no afa ha no afuri na we so we mu otwe inactivity and inattention as our actually and answer impulsivity one who say me wa brofo so bi am hweso say January na me jika madwuma as a pastor nyese bia interim na me call kwa na me call children's department wa boy bi oba teachers natural dey oto ha sa no he ni ti say who says on sabu table so pan nti aya na me so mo do mu ni no we na sa omo oto ano yesi o so ni ti say no atia kwa na chisa omo abohu na omo kira de onkora ni nyina busy no na oye na opusa na nsem say just a time bia no it's impossible as I saw you bibi or engage bibi sa me hwesa ti da ko na me yiri ko gina ha ye hwe teachers na ya na me kwhye omo nkran this kid has a mental health issue ye wo bebre a edadie asa woto obo ase asene a opani Patrick kan nye one time bi ana hyperactivity so hyperactivity say enu bi na make say akoda ibohu na ontimi time bia so or you busy for nothing o huri no odiam no sunsan no ho o tumri kan o twetwe ma consistently efie adwumam school mu na de be kwa sorry them see a picnic oduru ho ana to bo ase empaye hia nyame se empaye anya no kwa ye wo behavior and obo ha socially no konipa ma onim sane a eti ye niam efata yesi braso se ye ntena se onim yo e braso so bia kana ntum onim yo yesi munyina mon sorry na yenya de we just a social norms no doesn't know how to really fit in normally. You want to think about it, say, what can I do? I need to seek help. Mwabe brain or why bit my hair. Nyani wu sa obawo mental health issue. Now he hear chakwa. Na trebia ni esru doctor aka openi for isu edibia so say. Oh, ye ka sa obawo mental health na nya insanity. Hena na me perfection. Ye krom no ye group mental health na under insanity. In the case will be a mental health. I say, hey, we insane. Ebi nya do agina kageti a wa woro ne tro ho atoagu na gene no for be empany bi ne kan you. Obu ha Lomalinda University, ASG University wo West Coast, California. Omo ya adesua bi. It was it was a long study for, I think so it was about 18 years. They tracked the people and all that. Now, in part of their conclusions, and it do be away by all day. Omo conclusion they say. So SGA asked all them. You were mental health patients, maybe why you identify them. Now, time I do who your business meeting time. And I who say, one more no more diatam, no more cancer, no more talking for. But what has where they're not getting yet. Dr. Alon says, go ahead, chromoso, where the money had to do. That be our had to no attacking crofo, no ding crofo, or mental health problem. So when I diagnosed what I saw them, the in diagnosing crofo, business meeting, Sabbath school crown what they Sabbath school, so more the diatem, and the food what and sell brute table no free call. And answer Ubusa question, what German home, what attack you, or mental health problem. Na ohia mwa me so be a question bi o anti dora minim so nsa dada no anansa wasa so
me wasa foforo pese me de boa
okay
me pese me de boa ni say doctor FN say de ye beda ba kodi emfato hu say ye hu say ye nua Ghana ni bi wo ho a insese be ko no ye feri me example am pese me de mani say me ame ho me krom ha Denver ha Not me doctor, I feel me almost 15 years. Nanso so no bra doctor ba Priscilla ba ha oba krum ha no Mrs. Sam me doctor no firi ko adentia if you oye me krum ni enti yes ya ye beko ye krum no yes obache ne kasa nko ne me be ho no a ono ahwe wonu se de yan kasa Ghana fo ne me be ho no onimu a obetimi ayama wo na so obetimi aboa wo a obetimi I damn what because wait to my church, once wait to my wound, dear, how we wait a minute. Sometimes because I was spending more time with me. I didn't hear. She said, or means so I spend more time with other people, but what minute translate ma or can marry better my metimias. And yes, said, a man in high say, ye cromony be a one in dear near Bacon Horn, my and fair because ye young why a banish yamua, Madame Moissy.
And then I say boss if you say if you say me come chrome new ha or the back would come over baby amobia. No. Baby, I won't say a warm one cassa do for no almost war. Or more mra attack a church or more hip. Want me in fact wasma or the abrenon koyunkumudi baby. Said daddy, obey me losing a license. Nanya won't and woko losing a license. So enti and number 2 emsa wo kan antidora se ukrom ni chire bibi mu a obetima ka mese amwate ase yi se oba na ode ne ba yi wo ma me no bia wonnim kra kwana obefa so ene oba no onchechire mu ode ma no nyase ye ntebrofo yete na ukrom ni no obetimi aka ate o se hwe tora bi kra ye koko kan pampa keke if I'm Makodana, Emma, a good, a promote mental health. Who crom minimum bet my catcher. Brony would yes or nimby or back a drama, and no. And yet droning in and na a bonny. So, but Ukrom Nino or Nema who will be nims be away a culture no effective in helping. Research and I'm able boss one. Boha or see a guest school activities. So, activities be a betimi a chere wo mano social worker be name therapist be betimi a chere wo mana no mbe yo exercise and getting be just engaging in those activities no will help the situation no inti this is very, very important me subject say no ya na ya dia me gidi say twebo ase me do so no pa me be say me giafa is nyam na me kan enti Womwa saying, and name was Simbisa and saying, so be what, and one asking Bisabiwa, a kaka craving the Nedian so aquaria. Mental health among children. So, what is your comment? Say, one can be a harness medium, the number Busa, now also do the abwa. Doctor, be a me Musa question. And I mean a statement, now reflect on it. And run in there. No news, one American. We are Mama Georgina Mama Quine. Oh, news one may kind judge be yachino say o jailing koda na facility no it no kwa na man kickback. She say what in koda ko facility na almost a maniska and a yachino near soon to $200 million back. Okay. Ye brana me wo Andrews University so na ye ne African ibineti and an eba te me create 2 scenarios now I reflect on that nti bia obi o ha osuro se ne ba bia onyare me de ne ba kwa therapy pese hui hwa na yes e fa no nko probation a center bi said na kan residency bi no nko ho ne ye koye training bi so na do no se fa no nko no onya ska bi nti no yo sa no number 1 and on the other hand so no your bearing strings na your African bia na ne ba ewo mental health challenges. And to go school, and school mono recommend is a therapist man. Now, it was also related to developmental issues. Diakorano ne academic development in up to class and now. Almost say a special ed. Mamma said that from Bananco or special ed. A room how ya normally boon, and then call special ed. na ye delay na ontimi nsua de obewie su ontimi ko university e de ko technical school afi wo nse ne ya say no so na akora no bi ofri Africa ba ye ntino so ya mental health. Well, it turned out to say akora no nyini no, so we know the family, and once in a while no we bump into each other in some of the conferences I attend. It turned out say akora no mental health challenges. So when I know some developmental challenges, recently, I think about 5 years ago, and they call baby na me no share didn't come out and akora no say, you know, we at school no just say untimi ni peer ni age group no niema mutimi no untimi nlo nti ama why so much depressed. And so we have two scenarios. Ni ausuro sa me de be konia label no, and a be ana genuinely know there's a serious problem now no so on fan call because of labeling. What would you say to that?
Mamem, first of all, mamem bra judge na samna na okan. Unse say akola enkudi boni a yemfa ne nkokot. Na hwehwemu ama yehu say many at times no nkwala they get themselves involved in any kind of omunya abayama ne menka na sa no. Most of them have drug-related issues. Most of them have mental issues. And internet kurudwe womuno. Emra ukudi boni a ebia the same boni no penny dia koladi, but emra ya de makola no is a little bit different from the de penny. So bit what me kudi boni bia so dey or ya minor. Bia na penny bin so edi the same boni no. Baby, if my penny 30 years, I say, okay, wait, yeah, man probation, I say, man 5 years be. Now, yeah, reintegrating into the society. You know, they know, say, at least you are still uni, and there are some form of mental, why you need developing ye. But, judge, you know, yes, and there. I don't want to say it has something to do with discrimination and answer racial and answer based on in Kwalano Udeli Omono. If you run the statistics before the doors and answer the doors, that will be able to kind of understand. Say, okay, Udeli in Kwala say be a blacks more, minorities more, and answer more, you know. And not yet, unless you see the demographics of Kwalano Udeli Omono, that way you can be able to conclude. But then what I want to say is that nobody's going to place you in an unless you get yourself involved in like Abamani. And coming back to you know, two scenarios there. Obekona ya lebono ne de ihunjo no nso mpese obekono. I would say people who label omo intellectual disability no, it's wrong. Because but what I'm going to say is a crow women sebroni who be a onka.
Okay.
So bibia on sorry prekokanyos or baby oyare intifanabra na bejedru. But once they see it, more than say they have to tell you they two one among. You as a parent no. I say that as a guardianship. That is the term we use. We say guardianship. It is whom we work you have to inform the guardian. The guardian, like I said, there's nothing we as a State Department and as a professional, there's nothing we can do. And it's yamra say bia men who say asumesi ebepe emwana ya lebono. That is where intikro we maybe they try to talk about diversity and inclusion. It's very, very important because they want you to treat people equal, no matter what their issue is, mental issue, physical disability, just name it. The word diversity comes in, treat everybody equally with equal respect. And you know, it's wrong to label people. Say, obepemwa. And on the other hand, the onunsusurono, and it cried the nyakura. If you say, di obanabro, wo mamene die, ebia ube fees all boabano, but to be honest, obano na udinabro. So who so about TBA bi mu a make sure so you seek up na make sure say me can say when it comes to mental illness the one we consider that to be intellectual disability no yeah there's no cure for it. Yeah, we have autism, we have Down syndrome, there are a couple other ones. Yeah, they will. To mean cure. It is a crude if they identify say ABI or by autistic, ABI or autism, and now a Down syndrome. Now the nash them, so we should say would never be a Obano na hand.
Yeah.
Oh, how Bano. But again, mental illness can be treated with the right program, with the right medication. And then also so one swan on tamua a bayard cassie. Ain't no so beka basha demodia and no crowd and yakura oh how ban. So please say unim ubi your order to be any more what kind of basha demo a encouragement mean can say and a foot you and now the man say who didn't banabro on trust of a copemua at the man ban.
Yeah. So, Auntie Dora. Auntie Georgina.
But Matthias, Dr. Yedas in Yamishra.
Yeah. Auntie Georgina and Patron South.
Master, Lady Facher, Yedam was say, Dr. Yamishra Mopa. The more kind of meso make a cracker, me wa down phobi wa ha. Wo ba. Or tis a sancrophone na Madame for no nin to say nebano ayatisa. Me the media cry and fat on cher me wo me last born, me woni premature baby.
Yeah.
The hospital no time I ye me no mo catch us some person mom intervention for na omo befie. So mom intervention for befie no mo befie. Beni akrani exercise omo twetwe no omo ye ya to 1 year na doctor say hwe no ne ade nti edu be 2 years no o start say wo kasa ne bibia ya okay no na omo say de o ya okay nti no o say do mo ja me life ama me na am say okay nti madam for ne ba no me hwa akra na mitimu say bibi koso ba me make the media infanton catch and say omo intervention for emehwa akra ne ade no o na me ba no nyare omo pese omo ma akra no ba pastor wo hwa akra no a madam for ne yare ma me koje akra no be di me nche 3 days na pastor me ade call mani no me de ne kwa sorry akra ni se me the whole day wa sorry ho me ti pa ne ntena se so udi ni si form a no okọ profit ho enti no me hu die madam for no me hu ha wa me nsin ka bibia nkyere na obagia tum say bibi ha akra nti pastor me hia idea bi a mode be ma me a ne e tete me so tete me hu akra kama hu na say pastor untimi ntina say seconds akra
yeah
obeda nfi o remember bo anyina what say pastor ahu meteba madam for ni nyintu say ne ba no ewo bibi sa ha ne ba no uhu akora na pastor otimi say bibi ha no timi hia idea bi a mesumetimi e dia abo
name is a doctor am opening for you man is
yeah ma opening for you Penny Patrick
the patron sa idea no die do bit my yarn say obit my kai kan say bia manin ko woni for ya klar minim if a wodru ho no me fi say de me huntie manin ko woni pediatrics na wo hwe say bia enoma etosu ya say the bear no bit my den aboa because if pediatrics no refer no mental health a year a bit my den aboa
yeah
I didn't make us who say your culture no your mental health and was yare or your culture.
Yeah.
And apart from say nipa kwa be lebo wono yeah kasano sebi if you say and was yare soko and to yana amani dimpa said ye obi beka say o jai den atumo and in addition to sound labeling This way, ya kola. Do bit my yarn say, hey, any bomodia na uncle huni pediatric.
Yeah.
Na one can't ye oh, pediatric no bit my who say, Ebia say no. Uncle who's psychiatric, and that's so cool him no much anything M1. I know another way I'll be to me. I encourage you when we're seeking mental health help. And I dear back pastor and doctor, they make and say, you can't say bodam I know you're schizophrenia. Okay, now can you know one way or the other? You know, I do be an entry. So, mood instability, and your mental health, say your physical health, and our medical health, say your mental health issue. It is will be a depression, and just what about them? Oh no, you should pan a schizophrenia and a manic and psychotic, and I'm not your chrome, you fully say about them.
Yeah.
It means say, mommy encourage you who say, you're more than you hear more.
Yes.
Yeah. Let me say, medical crackdown. I think we say most of the times, yeah, the Marco hospital, yeah, time my forms be say, yeah, feel it. I na ya liste, obano pisun, good to me, calming it down. Like they ask some questions here. Ana den one person akulano. Not just the medical aspect, but the mental aspect as well. Because one time they may back get one call appointment na. In fact, may check your forms no. Now I was just me check it could be wrong answer. Maybe if you na doctor no. Efrem say me ba ho me check say me ba no pisun ne ayi bina or say or recommend am so any mistake na me ba no pisun because akolo pisun here then definitely untumi encalm down ana akola uhunipa untumi kan ne ho nko omo no definitely there's something wrong somewhere. But sometimes I don't say Ghana we bu ya kwa ni twetwa ntro kakra of forms no so just because pese bia be feelings bia ya ba no ewo how be most of the times ya the man no call so let's try to be a little bit honest kakra and so because boa say omuhu problem na omutumi eso anontem and the idea ehia pa see who problem na betumi aso anontem ma enkofa asem kase bia Emma.
You want to do a salmon in Sasso? Minim Gina Sabua Kakra.
Pastor, Abu and Adia have me Kakran is 5 years. So now on Casa. It's I mean, one saw my no moon who said be cost.
Yeah. It's only opening for Ricano. A beer to know for say, or call a pediatrician who are on can children say, and I was understand to the correct call doctor how I'll catch and say situation we in a cost. So not can I be say it be our wagging yourself what check than a casa beba. I'll call pediatrician or then call money pediatrician manu who say in a cost. I think so by this time like the same so or call follow ups near there probably kind of wonka.
Yeah. Mama can for unze young Ghana for no. Sometimes even within one household, no. Maybe a wufu bo me ba we di wankasa ntemu. Oh, we di wache pa so kasa.
Yeah.
Oh, we di 3 years to crown one and that kind of that kind of experience. I say yenya nintino. Ye fan say bibia de we di normal sanity. Ba kru de mu no. We so do mark hospital. Omo di book na enyini o. Or the graph ba be kire. This is the median, this is the normal curve. Obano fall under. So there's something, wrong. I had the assembly masim here. But again, the woman say, you as a parent, no. So one copem one. Omuntu me mechichiro se kia chinchinia bra nabeji. That is where your problem no. As we maybe before.
Yeah.
We in cranche and edima say. Yeah, let's try to take advantage of welcome
yeah. Yo, Antidora asama on saso nti ebema wa twato na afi de ne de no kwa wie.
Pastor Mpacho me kasa too much.
Oh, that's okay. Eno nti ne yo ha.
Na akra me so me fese mbusa doctor ni se. O nse nkora bi wo ho no ma ye wo wa. E won nkora obi wo ho omo ani agi omo ani so ohye. Eno so ye offense mental health no bi anam because nkora bi wo ho no ma omo ani so ohye pa. Enti no so enna de tosu mienu. Me wadamfo bi wo ha. Na ne benya 14 years. Enna odi akọrọ hospital. Enna o kache ni doctor ni say o depressed. O just say ultimately say no kache doctor no. Na ma me to was doctor is not true. She is fine. Everything is fine. One so non temo no akọrọ nyi ye no. Onya wo how. Enti say o kan Ghana for boy catch ani you're blushing off. You feel saying you be and so akọrọ no what na hospital catch doctor say or depressed. Now so what about to say at the end of how wo did you kwa that them kwa the end of how and maybe how you can see a man can yenti madam they say when you how but my same bisa and two Dr. Mpacho.
Yeah. Penny Patrick, Ober responded to that question, Mamiana.
Yeah, and it's also
Dr. Wanenko.
Okay. So enkwala omoni so ahye no it's not always and America say yeah adwuma, but in some situations also na ye your friend is saying mental illness but again the new so keke dia I wouldn't jump into conclusions say mental illness send your opinion Patrick Digagan your symptoms and not just one symptom. It should be kind of collective of symptoms via everybody who say oh okay based on this number of symptoms this is the diagnosis akula the initial she krakrakrakane a bit may say or some form of mental illness and as a bit may say be the initial na kind of shit keke it means me wasem na no na say about mental illness and we want the professionals not to be able to observe the person and diagnose. So you just can't jump into conclusions. Oh, we dear, and I'm say ope ebufu or a bipolar. Oh, you have to get like the professionals to observe the person, know the symptoms before they can draw a conclusion.
Na doctor, kakra me dey beboa no so say so for me to me am kakra bia. On say developmental stages no a milestone bia na say years bia anwo die any yesu. Wow no. It is a crown or terrible two say the be sika na not talk say no. Normal says our age no better than or better say no. Na make us say na when you do 6 years, na afraid the name any kwa ni nyina na de bia na ni so na na bia na nka we free sa pempenso no eno nti na ya na say hu say yenye observant yenhwe patterns ni yenhwe symptoms no then first of all we refer them to our pediatricians no we make na bo say dey ko so die ka be wo do na say ka we den ko pa hu nyina no wo 20 years wo dey 20 years for the when you're 40 years, who are the 40 years for a year? And it's when you're 60, not a baby, no officer, you're superhuman. That's a way to mess over speedy now, baby. And that there's something wrong somewhere else. Yeah. It's a bad side, young she stages, you know. Young she say it is appropriate for our age now. A bit enough 1 million woman. Yet me seeking help for that.
Yeah, Penny Patrick, that's I mean, sure.
In fact, me cram you know, say. And then I did determine say ubi any source. Why won't say you know you use natural descriptions to say ubi cry assertive. It's in any other. Also ubi or canagony. Maybe children on function it's in any other. Okay. Until no one I did determine. Maybe had to know over over the board, mean cousin, overboard. So, say, Nipano, ana kodano. The normal social behavior, said the doctor, okay, say, Koni Pemua, and Kodang in AD, I would not come home, I said, Usrubisa. And you're normal. The age, sending up any for Rican, were deemed fear 6-year-olds, say no more tayo. This 6-year-old, no Koni Pemua, no one who Jamabi. Because also, hey, I said, baby, it seems, it shows to say something is not right. In this ano, parent, no, Fakwa be so now, what they no call, make a hospital, a medical appointment. Now, quite catching a doctor and said, my watching a ban in a TV, young and I did crown watch a shabby to a mom who's or to me, who say, the social relations and social norms are not up to as normal to me. American. Timber some of your testing, mammy. Oba titu ye can call adino. So we are champion of your child. Oh, now we advocate. Wona we ukasamano, wona utien sem busebusemu, na ni esha ubia na yetimi ayi aboa. Anya sa akoda no benyini na afi nkoda ni nyina ekọ university. Agni o say, I will be a high school there, will be at university. I was in socially no untimi related with me pay. Untimi think deep. Oh, and assessing near be a na or in Kodakra or basketballer, he or she doesn't fit in very well. Because the lingua use the mannerisms of put up who said he's lacking something is wrong somewhere. Yada nyamiasi nyamema send nenso ye brena ye bre nkomana ye de doctor eda asepa se nyamena moso na ne wasan abedi animu aboayen acheche mu ye amai minim sa obesan aba minu ma wo ade yi so ne me hye on kran se ade yi fa bi komo obi ena de yi no de problem anya na nimu ho ntino ye wi ama de tene kakra bi na me de nimu ho na be hye ho na ansa na mapostu nti bi ya wi na no kwa onhu me wi a me de announcement but to chat in so nyame nhyran doctor so our concluding statement bi ansa na ya bompa ya
emi say and that the yenya kunya contributions na doso yeda obi bia otumi ebo ayase dan da na ye behiem na me sure say na eye adesua de bebre mai ntimesre say yembo ye homoden senior last week ye hia ya na ye ka indubone ho asema ye ka say ye ma no ene ye dachi no the same way and I conclude na say ye ma no ye dachi and you know, we should be able to support them in any way, any form. Kwan bia betumi afa so aboa ama ye mano so etumi di ye wokodu emu no. Yen try say ye befa so. That's it.
Yo Dr. Boampong Akese yedase bebre say nyame na moso ne etiefo ne ho amoboa ye nyina so nyame na mede ne damo ase na otwe bia da so yeto aso hia na yebekoso de adesua eboa abusua abrayen unya bi afama obi ene obi ni hu nkomo unim nia enam oso nyame be ya ma saa nipa no rade nhyira no nkan ye ho mo mpa yehoa ede wasio senenso ode yen eba wanim na onam Dr. Boampong so akyerɛkyerɛ yen enkoda yare ya titu won mo muntimi nkasa omusapa bibi ho mo muntimi nka boaya wofui na niema esese yehunu na yenso ye de aboa mofrɛ no etimi atu ho anamo enigmedi ye de hyɛwonsa so se kan ye ho ma yentu ho anamo mfa enya adwuma wo ye musuamu aboa ye ne yemma hyira yen wakwa so bekyerɛkyerɛ ma no nimdeɛ saa na wetimi atoa so de aboa yen na ase yenka odin awrade o Jesus Christ din mu amen nuanom nyame explain na on kan ye ho na nyawohwe sende no yehoa ya adoma ebetie ho nka bio nti ene na yadwuma edi wie no ene de ekro no